We introduced the International CML Foundation Prize, I believe, in 2015. And this is to recognize somebody who's done outstanding contributions to improve the outcome and the care of the patients from emerging regions of the world. We know that patients in many parts of the world and physicians taking care of those patients and those who are doing research in those parts of the world face incredible challenges. And there are individuals who really dedicated their life and make a real impact on improving that outcome and the treatment for those patients. So to present today's awardee, I'm going to ask Professor Pier Paolo Picaluga to come to the podium and introduce the winner of this year's iCMLf prize.
Thank you, Dr. Cortez. Dear colleagues, good morning, almost afternoon. First of all, I wish to deeply thank the chairman of this conference and the whole steering committee of ASH for the honor of presenting this prize today. And as well, Camille and all the organizing team for the great job. The entire conference we are attending at is dedicated to the memory of John Goldman, a real pioneer in the treatment, in the history of CML. And the prizes that have been named to his memory has been dedicated to lifetime contribution to the management of patients with CML, and particularly the commitment to clinical excellence. This specific award we are dealing with now acknowledges individuals who have made outstanding contribution to improve CML in middle and low-income countries. And you can imagine how difficult it is and how big the challenge of facing malignant disease in low-income countries. But since we are dealing with CML, you will forgive a very short digression, since my thoughts can avoid to go to my mentors, Sante Tura and Michele Baccarani and the School of Hematology in Bologna. They've been dedicating their life to excellence in hematology and particularly to CML with Professor Baccarani, former award-winning in 2015. They dedicated efforts in both the definition of clinical standard of care for CML, from interferon to stem cell transplant, eventually to the TKI, and established laboratories for the molecular and diagnostic of CML and the definition of the criteria of response. And indeed, they left at least 2 generations of doctors and scientists, 3 of which are here with us in the room, that are continuing their mission. But focusing on my friend Nicolas Otieno Abinia. He was born in Siaya, in a small village in the lake, close to the lake of Kisumu in Kenya. By chance, the same village where the family of Barack Obama was born. So I guess probably there is something good in the water or something in that place. He had been allowed to attend some of the most prestigious schools in Kenya, like the Alliance High School, the University of Nairobi, and therefore the Royal London Hospital under the supervision of Oliver Thiem. And then he served as a medical officer in the Homa Bay District and Nyamira District Hospital, and later on as provincial physician in the province of Garissa, a huge province in the northeastern part of the country. And these are not big hospitals, this is not hospital with facility, this is real frontline medicine. And to know a little bit more about Kenya, about which maybe some of you are not totally and completely aware, Kenya has a population of about 50 million of people, with Nairobi the capital with around 5 million right now. And the total expenditure from the health system pro capita in a year for single individuals is below 80 euros. The life expectancy is currently just above 60 years old for male and 66 for female. And what about the infrastructure? In the whole country, we have 3 comprehensive cancer centers, 3 of which in Nairobi, all of which in Nairobi, radiation oncology centers between Nairobi and Eldoret, another academic city, and then smaller medical oncology and hematology centers in Eldoret, Mombasa, and Kisumu. But when we look at the numbers of professionals working there, we are even more impressed, because we have as few as 7 medical oncologists, a few radiation oncologists, only 1 pediatric oncologist, and as little as 3 hematologists right now that are to dedicate their effort also to the diagnostic laboratory in hematology. And as you can imagine, it's not all the same being in Nairobi in a maybe better developed area or being in a suburban area or Nairobi itself or in the countryside. It means probably not having any chance to assess the health system. And that's why Professor Abinia recently founded and launched a new private foundation called Foundation for Health Catalyst to disseminate health centers, smaller but specialized in the whole country, to allow even people from the village to access any medical assistance in oncology. But Professor Abinia, after that frontier medicine, could be also the leader in the major institution in Kenya, particularly directed the oncology services at the Aga Khan Hospital, at Nairobi Hospital, and the Kenyatta National Hospital, the University Public Hospital in Nairobi. And during this career, he could be the founder of the Medical Oncology Fellowship Program in 2016, and later on a very specialized program in gyneco-oncology, and later on also the Master Medicine Program in Radiation Oncology, allowing the country to create, to form and train specialized physicians in the field. As a researcher, you can imagine how difficult to run research in Kenya, but still he could give a very significant contribution. And here are only some of the examples of the collaboration he had with Italian institutions. First of all, with the molecular profiling of endemic Burkitt lymphoma. Now we know it as EBV-positive Burkitt lymphoma, with the friend Lorenzo Leoncini in Siena. Then the molecular profiling on Kenya AML, and we produced the first paper on NGS applied to AML from Kenya, and we found that indeed the genetic profile is a little bit different from what we found in Western countries. But then, for the focus of today, I dedicate many efforts and scientific contribution to CML therapy, and a series of works on use of imatinib, the use of ponatinib, and other tools for CML care. But in this regard, the real greatest contribution, I think, from Professor Abinia to the cure of CML in Kenya was establishing this Glivec International Patient Assistance Program, the GPAP, at Nairobi Hospital in 2005. And since then, he's serving pro bono for free every single week, since 20 years on Saturdays, to assist patients coming from the whole country. I had the privilege to serve in the clinic, and I can tell you that patients are traveling overnight from all over the country, from the coast, from the inner side, from the mountain, just to be able to receive the treatment, because they can get drugs for free, assistance for free, and all the diagnostic procedures. So I think this is really something big that was created. But Professor Abinia is not just in Kenya, he's also one of the major voices of Kenya and African medicine in the world. He's one of the most prominent exponents of the American Society of Clinical Oncology. He has been appointed by his government to translate the international guidelines, example from the NCCN, into the real practice in Kenya. And as you can imagine, you cannot just copy and paste the guidelines, but you have to adapt for the drugs that are available, for the support treatments that are available when intensive treatment are considered. He's one of the most prominent voices of the Association for Oncology Research and Training in Cancer, the ASCO, let me say the African ASCO, and representing worldwide Africa, and he's a founder and permanent chair of the Kenyan Society of Hematology and Oncology. This brilliant career, of course, has been awarded extensively, and in 2010, he received a mention as a fellow of the Royal College of Physicians in Edinburgh for the excellence in medicine. In 2018, a very prestigious award, the Harvard Global Health Catalyst Distinguished African Ambassador Award, again for the efforts in excellent medicine. Then in 2022, Cascio awarded him in recognition of the service to medical oncology and humanity. And again from the Cascio, he received the Association of Physician Mentorship and Succession Planning Award. And I think this is very meaningful because, as John Maxwell said once, a leader's value can be assessed by assessing the successors. And indeed, Professor Abinia could train a generation of great doctors that I personally met, some of which Andrew Odiambo, now the director of the oncology program at the University of Nairobi, Mohamed Ezi, the director of oncology at Karen Hospital in Nairobi, Mercy Gatua, by the way, the scientist doing the NGS in AML as his PhD thesis with us, who's leading probably the most advanced leukemia, acute leukemia unit in Nairobi at Kenyatta University Hospital. And then Peter Ohiro and Matilda Ogondi, they are carrying on the activity of Prof at the University of Nairobi Hospital, the Kenyatta National, with the ward and the clinic daily. And last but not least, Noel Onyango, a PhD leading the research, the biological research at University of Nairobi. And I think this ensured a decent, great future for our patients. So actually, he is a great clinician, taking care of thousands of patients over the last years, an excellent researchers and collaborators in international programs and clinical trials, great mentor for many doctors. I would say most of the oncologists and hematologists in Kenya, they are the progeny of Professor Abinia and the architect of what is now the oncology system in Kenya. A great leader, but also a friend and a family man, and in short, I think the best example of a life dedicated to the highest ideals in medicine. And so, ladies and gentlemen, please join me in the warmest applause. And please, Professor, you are welcome to the podium. Congratulations, Prof.